Now let's look closer at the off-pump coronary artery bypass surgery. You will be given medication to be pain-free and asleep during this procedure. The necessary grafts are created by surgically removing sections of blood vessel from the leg and/or arm as needed. These incisions are sutured and bandaged. To reach the heart, the surgeon makes an incision down the center of the chest. The sternum bone is carefully cut. A retractor is then placed to hold the edges apart, creating a working area. The protective sac that surrounds the heart, called the pericardium, is opened. The surgeon inspects the heart and identifies the vessels to be bypassed. The intended grafts are stitched into place as needed to complete the necessary bypasses. Blood flow through the grafts is checked. The pericardium is positioned back over the heart. Flexible drains are placed, and the sternum is closed and supported with wire or small plates and screws. The remaining tissue layers are brought together, the skin is closed, and a dressing is placed. After a cardiac bypass graft surgery, you will stay in an intensive care unit, ICU. You may have a breathing mask or tube in your throat until you are awake and strong enough to breathe on your own. When you first wake up, you will have some confusion. This typically improves in a few hours, but may take longer, especially for elderly patients. You can expect to have some pain, muscle aches, bruising, and swelling. Pain medication will help. Other approaches to providing comfort and pain relief will also be used. You will be transferred out of ICU when you are breathing without assistance, and your heart rate and other vital signs are stable. As your hospital recovery continues, the focus will change to assisting you with increasing your activity, even walking. Early return to activity and eating tends to lower the risk of complication. You will learn how to keep your incisions clean and dry to lower your risk of infection. This includes instructions about when to shower and how often. Drains are commonly removed before you leave the hospital. Your hospital stay will last several days. Although you will be carefully monitored, you can help your care team to recognize problems early by speaking up if you have dizziness, difficulty breathing, unexpected pain, or other concerns. Serious potential problems related to this surgery include internal bleeding, stroke, heart attack, and irregular heart rhythm. Other risks of this surgery include lasting or permanent memory problems, infection, and blood clots. The overall risk of death arising from these complications is about 3%, or 3 of 100 patients. Your personal risk of complication from this surgery is most related to your age and health before surgery, the severity of your heart disease, existing heart damage, and the experience of your surgeon. Be patient as you heal. Communicate your concerns with your surgeon. If you do have long-term side effects from your procedure, you will likely see improvements slowly over months as you continue to recover. For the best results, follow your care instructions and call your doctor if you have a fever, worsening pain, swelling, or redness in your legs or at your incision site. Call 911 if you have chest pain, shortness of breath, dizziness, bleeding that doesn't stop, and any other sign that you may be having a complication from the procedure. Hospital admission, medication, or surgery may be needed to correct some problems. Coronary artery bypass surgery is not a cure for heart disease. Keeping your heart healthy depends on lifestyle changes that can include simple dietary changes, like cutting back or eliminating sugary and fried foods, soda, and junk food. You may need to start an exercise routine and find ways to manage your stress. Get enough sleep. Do not smoke. Follow treatment recommendations to manage your medical conditions, especially diabetes, high cholesterol, high blood pressure, and sleep apnea. You may need to take aspirin and other medications for months or years to prevent a blood clot, depending on your situation. This can be critical to prevent a bypass from becoming blocked. If you are being admitted the day of surgery, you can help to avoid cancellation or complications from anesthesia and your procedure. Do not eat, drink, or chew gum after midnight, the night before the procedure, unless you are given different instructions. Take only medications you were told to on the morning of the procedure with a sip of water. Follow instructions regarding aspirin and blood thinners before surgery, as you may be asked to stop or continue taking them depending on your situation. And arrive on time. Be ready to confirm your list of medical problems and surgeries, all of your medications, including vitamins and supplements, your current smoking, alcohol, and drug use, and all allergies, especially to medications, latex, and tape. All surgery and anesthesia have a small but possible risk of serious injury, even some problems very rarely leading to death. It is your job to speak up and ask your surgeon if you still have questions about why this surgery is being recommended for you, the risks and alternatives. This video is intended as a tool to help you better understand the procedure that you are scheduled to have or are considering. It is not intended to replace any discussion, decision-making, or advice of your physician.